Hi everyone, welcome back to my YouTube channel, and today we are going to talk about operative dentistry. So let's start our topic with introduction. Operative dentistry is a vital branch of dentistry that focuses on diagnosis, treatment and prevention of disease affecting the teeth. It primarily deals with restoration of tooth structure damaged by caries, trauma, developmental defect or wear. The main goal of operative dentistry is to preserve natural teeth, restore function, maintain aesthetics and ensure long-term oral health. Modern operative dentistry emphasizes minimally invasive technique focusing on conservation of tooth structure. Definition: Operative dentistry is defined as an art and science of restoring diseased or damaged teeth to proper form, function, and aesthetic through the use of various restorative materials and techniques. This specialty addresses both preventive and corrective treatments aimed at maintaining healthy teeth. Objectives of operative dentistry. First, there are functional objectives as it restores normal biting and chewing ability, it maintains proper tooth contact and occlusion, it prevents further breakdown of tooth structure. Then there are aesthetic objectives as it restores natural tooth color and shape and it improves smile appearance. Then there are biological objectives as it prevents progression of dental caries, it maintains pulp vitality, it protects remaining tooth structures and it prevents recurrence of disease. Scope of operative dentistry. First is diagnosis of dental caries. Operative dentistry involves early detection of caries through clinical examination, radiographs, and special diagnostic tools. Then there are preventive dentistry that includes methods aimed at preventing decay such as fluoride application, pit and fissure sealants, dietary counseling, and oral hygiene instruction. There are restorative dentistry that is repairing tooth defects using restorative materials such as dental amalgam, composite resins, glass ionomer cement, and ceramics. Fourth is management of tooth wear as operative dentistry treats abrasion, attrition, and erosion to restore the lost structure. Fifth scope is management of dental trauma as it includes restoration of fractured or broken teeth using bonding, crowns, or veneers. Princip- Principles of cavity preparation. Cavity preparation is one of the core procedures in operative dentistry. The aim is to remove decayed tissue and shape the cavity to hold or restoration securely. First is outline form as it determines the shape of cavity based on extent of decay. Second is resistance form as it ensures the restoration can resist functional forces. Third is retention form as it provides mechanical retention to keep the restoration in places. Fourth is convenience form as it allows easy access for instrument during restoration. Fifth is removal of carious dentine as all infected dentine is removed to stop disease progression. Sixth is finishing and refining as smoothing and shaping the cavity walls for optimal restoration. Restorative materials in operative dentistry includes dental amalgam, that is a strong durable metal alloy that is used mainly for posterior restoration. Second is composite resin, that is tooth color static material widely used for anterior and posterior restoration. Third is glass ionomer cement that releases fluoride, making it ideal for cervical lesions and periodic dentistry. Fourth is ceramic and porcelain that are used for aesthetic inlays, onlays, and veneers with excellent appearance and durability. Fifth is bonding agents and adhesives that are used to bond restorative materials to tooth structure. Techniques and procedures in operative dentistry include direct restoration, in which the restoration is placed directly into the prepared cavity during a single appointment. Examples include composite fillings and amalgam fillings. Second type is indirect restoration, that is, restoration fabricated outside the mouth in the lab and later cemented on the tooth. Examples include inlays, onlays, crowns, and veneers. Third is tooth isolation, that is use of rubber dam or cotton rolls to keep the area dry for better restoration. Fourth is matrix system, that is to help shape the restoration and maintain contact with adjacent teeth. Fifth is finishing and polishing that improve aesthetics, smoothness, and longevity of restoration. Infection control in operative dentistry. Strict protocol ensures safety for both patient and healthcare workers. It includes sterilization. All instruments must be sterilized using autoclave. Second is personal protective equipment as dentists must use gloves, masks, eyewear or protective gowns. Third is clean working environment as surfaces must be disinfected and cross contamination prevented. Preventive aspects of operative dentistry. Operative dentistry is not about restoration, it strongly emphasizes for prevention. It includes fluoride therapy that helps strengthen enamel and prevent caries. It includes sealants that are applied to fit and fissures of molar to prevent decay. It includes diet counseling that includes limiting sugar intake and educating patients on healthy dietary habits. It includes oral hygiene instruction that is guiding patients on proper brushing and flossing techniques. Challenges in operative dentistry. It includes recurrent decay, that is improper restoration or poor hygiene that may lead to secondary caries. Second is material longevity issues, as some materials may wear or fail over time. Third is patient compliance, as success depends on patient maintaining good oral hygiene and regular checkups. Fourth is sensitivity, as postoperative sensitivity can occur after certain restorations. Recent advances in operative dentistry include minimally invasive dentistry that focus on preserving maximum natural tooth structure. Second is laser dentistry that is used for caries removal and cavity preparation with less discomfort. Third is digital dentistry that is CAD/CAM technology that help create precise restoration like inlays and onlays. Fourth is bioactive material that are material that promote remineralization and healing of the tooth. Conclusion of this lecture video: operative dentistry is essential for maintaining oral health, preventing disease progression, and preserving natural teeth. Through a combination of diagnostic skills, preventive measures, and restorative techniques, operative dentistry ensures long-term function, aesthetic, and comfort for patients. With continuous advancement in materials and technology, the field is becoming more conservative, patient-friendly, and effective. And this was all about operative dentistry. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.